So we're delighted to be here today at the Can We Talk event in Cookstown, which has been jointly held by the Mid Ulster and the Glenavon locality planning groups. The event was initially planned for March 2020 and had to be delayed because of lockdown. During that time, there was more of a need for emotional wellbeing support for children and young people. So they agreed to resume plans for an event that has been held today, the Can We Talk event.
Cross your hands over the other, turn your palms towards each other.
We've had a number of speakers from across the Mid Ulster area talking about support for children and young people from birth until adulthood. We've also had a large number of information stalls. We've had over 20 in total, highlighting the support available for children, young people and parents across the Mid Ulster area.
At last we're here, 3 years down the line. Same problem, different circumstances, probably a problem that's bigger and worse than it was when we looked at it first 3 years ago. The mental health and well-being of our children and young people. We now have new partners with Dungannon, and hopefully together we can work towards this.
It is extremely important for me as council chair and as one of my priorities to endeavour to safeguard and protect the mental health of our young people. So it is extremely timely that we have the Can We Talk event today to see the services that are offered to our young people and that they know the groups and organisations that are out there to help, that they can reach out to for support and some advice and guidance.
So children and young people have been telling us that their emotional and their mental health and well-being is a priority for them, and they've been telling us that for a decade. Since the pandemic, we know that young people have experienced worse mental health and well-being because of the absence of school and because of the absence of social relationships. And now we are in the middle of a cost of living crisis. Of course, children are going to pick up the fear, the concern and the worry of their parents. But the other thing we know is that our child and adolescent mental health system cannot do it alone. It needs to work in partnership, it needs to work with the voluntary and community sector, it needs to work with earlier intervention services. So that's why it's really important that we talk about partnership, we talk about voluntary and community sector, working with the statutory sector to improve the emotional and mental health of our children and young people.
It's been a very positive day and a great opportunity for attendees to find out what services are available for children and young people on their doorstep.